Welcome back. The Nuclear Energy Corporation says it's conducting clinical trials that could help in the fight against cancer. But production at the facility has been temporarily halted following a breach in safety procedures. John Bailey explains.
This facility generates roughly 3 million rand per day when it's fully operational. But due to what Enca describes as a minor technical problem, radioisotope production's been suspended. Enca says it expects to receive the green light from the nuclear regulator to resume production soon. The government entity says while it's had to temporarily suspend operations, it's redesigned its equipment to be more sustainable. At the same time, it's also enhanced capabilities with its research partners to produce more cancer-fighting drugs and hopefully reduce cost as well.
We're spending about 200 million rand over the period, the 8 years, to ensure that we can have a prostate cancer blockbuster. As you know, prostate cancer kills a lot of people. We need to have a breast cancer treatment capability. We are working on gallium-68 PSMA to ensure that we can treat breast cancer much more in a very specific sense rather than in a general sense.
In recent times, concerns have been raised about the continued high cost of cancer medication. Enca says more treatment centers should be made available to prevent the high cost. In the meantime, the Competition Commission says its probe into why cancer medication in South Africa is so exorbitant is at an advanced stage.
We have to do this investigation. As I said, at face value, we look at these drugs, they are huge. In some cases, we find a drug in the private market for 500,000, whereas the same drug is administered for government at 200,000. There must be some explanation in terms of that huge discrepancy. But is it something that we must accept at face value? Is it something that is competitive? Is it fair and a competitive conduct? So that's what we're investigating. We need to understand the prices because a lot of people are dying.
There's no certainty yet when the Competition Commission's investigation will be completed, but it's hoped that it'll reduce the cost of cancer medication in the country. John Bailey, Pretoria.